Linda, are we waiting for a lot of others, or should we go ahead and get started?
See, we had 22 responses, so I think giving it a few more minutes might be wise.
Sounds like a great idea.
Yeah, let's just hold. Oh. You say one more minute and then we go? Okay.
All right, welcome everybody. Good afternoon. Thank you for joining us for FLPPS's Long-Term Care Workforce Program webinar series. I know it's been a while since we've had a webinar, but here we are right smack in the middle of the program, start of 2025. So we thought it would be a great opportunity to bring you back together as a group, review a bit of an overview about the program. There's a couple of minor changes. And I know that we have a lot of new folks that are joining, including some brand new success coaches. So we thought it would be a great opportunity to really kind of share some information about the program with them as well. So my name is Christina Owens. I'm a program director. We have a couple of other individuals that are joining us today. Amy Molina from Finance. You probably know Linda Mead, um, who joins me. She's a senior program manager with FLPPS and joins me in on a lot of our monthly meetings, as well as some other meetings that we've had with the group. Whitney Bubb is a staff accountant from FLPPS, and if folks have not yet met her, I'm sure you will have an opportunity to, as she has joined us and is now a part of our review process for monthly submissions, as well as Shivam Kaur, who is a data analyst here at FLPPS and will be assisting our team reviewing the data portion of everyone's submissions. Next slide, please. All right, the agenda today, we are going to be reviewing the long-term care workforce training program, specifically quick review of the program, allowable expenses. Then we'll be talking about some best practices, little overview of the portal, and the required template for submission. We'll talk about the expenses and documentation that's required from our finance team. And then we have some partners that have been doing this work that would love to share a bit of their experience and some best practices. And then we'll have some time for questions and feedback. And then we can wrap up. So just a little housekeeping. Please keep yourself on mute throughout the presentation, and please feel free to go ahead and put questions in the chat as we're going through. And like I said, when at the end, we'll have some time allotted to look at questions. Next slide, please. All right, so this work was started, like I said, 2 years ago. FLPPS has been working with I believe it's 11 contracted long-term care partners. And we've been working to address the critical workforce shortages in skilled nursing, which was this problem's been going on for a long time, but it certainly was made much, much worse by the COVID pandemic. So Monroe County had recognized that need and very graciously awarded some ARPA dollars to support this work. It's been a collaboration with the skilled nursing facilities that we've contracted with, along with training organizations, community-based organizations that we've been working with, and several minority and women-owned businesses as well that have been adding some additional training sessions for contracted partners. So in a nutshell, these funds have been allocated to help support skilled nursing positions such as CNAs, LPNs, and RNs. They cover tuition costs, books, supplies, fees, prerequisite courses, career counseling, mentorship, a variety of wraparound services, childcare, housing assistance, also the mentorship and other retention stipends, things of that nature. We have also been supporting organizations to use these dollars for integrating success coaches into their programming as well, which has been highly successful. So as far as the tuition assistance is concerned, we are the last dollar in. So we encourage all of the employers to utilize any scholarship opportunities or other tuition assistance that their employees may be eligible for. But we can cover 100% of the tuition gap if the employee goes to MCC or if they've applied and have not gotten in or have started someplace else, we can also do 100%. If they decide simply to go elsewhere, we can cover 50%. This is inclusive of tuition and any other expenses that are on the tuition invoice, including fees, things of that nature. Next slide, please. Okay, allowable expenses. This is just a snapshot of some of the allowable expenses. For those of you that have been doing this programming for the past 2 years, you've seen it is somewhat flexible. So under career coach and mentoring, these are different tabs that you'll see on that reporting and expense template that you've all been utilizing for your monthly submissions. You've got an invoice tab, you've got your demographics tab, and then you've got a whole bunch of other tabs that are really kind of cost categories for these allowable expenses. So under career coach and mentoring, any of those folks that have been utilizing career readiness workshops by AVS Consulting Services. That's where you should be putting those expenses, as well as for those organizations that have been supporting success coaches. Some organizations are expensing the salary. You can go ahead and put that on that tab, and others are doing it as a per person charge. It can also be put under that particular tab. Childcare, obviously daycare expenses for children of participants can be put in there. And I have to say it's a little underutilized. So if there's any other organizations out, if any of the organizations know of individuals that could use childcare while they're going through this training, please encourage them to avail themselves of that opportunity. Under the education tab, this is where most people are putting most of their expenses. This is where all the tuition expenses go. Just a note that the tuition bills, we can cover expenses minus grants or scholarships. So if there is a tuition or any kind of tuition or financial award, if it includes a federally subsidized or unsubsidized loan, we can reimburse for any of those loans. But anything like a Pell or any other grant or scholarship opportunity, any free dollars, we will not reimburse for. Please feel free to ask us questions if that's not clear. Again, there's folks on the line from finance who will be talking more specifically to that as well. Employment, under the employment tab, this is where individuals, where you can put the individual wages for individuals that are in training to pay them for that time. Also, if you have had a career readiness workshop and you're going to be paying individuals for their the wages for their participation in that workshop, you can put that under that tab as well. Housing, rent, or mortgages can be expensed there. Under the incentive or bonus tab, any type of completion, retention bonus, or stipends. I know that some organizations, specifically for CNA training, are paying a specific dollar amount for wages. That would go under employment. However, others are saying we're going to pay a bulk stipend of X amount per week for, successful completion of the week or upon completion of the entire training. That would go under the stipend or incentive tab. Supplies, textbooks, scrubs, any other types of supplies can go in here. I know sometimes those supplies are on the tuition bill, but we prefer that you separate it out onto two different tabs, the tuition on the education tab and those associated supplies, scrubs, etc. on the other tab. It just helps us when we're reporting out to the county to be able to look at the different cost categories in a way that makes sense for them. And also we have technology. That could be computers, laptops. It could also be for individuals that are utilizing a hybrid CNA training, for example. I know there's some technology fees associated with that. And finally, transportation, another one that's a little bit underutilized. Bus passes, vehicle payments, Ubers. We've also had individuals who have had transportation expenses such as car repairs or a lease or something for a car payment. So if you have any questions at all about allowable expenses, please talk to us in advance. We'd be more than happy to clarify any of it for you. But I think it's a great opportunity for a variety of different expenses to support these individuals. Next slide, please. All right, best practices with the portal and the template. All right, so I'm sure you're very familiar with the template. The demographic trainings and programs tab is where you will have a running list of all of your program participants. It outlines all of the demographic information required by the county, and you should use last month's submission whenever you're starting so that you can just add to the bottom of it. Make any changes to previous participants as needed, and then complete all of those columns and with the data and the information for any new folks, with the exception of the household yearly income and number of household members. If you don't have that information, you may leave that blank, but everything else should be completed. We have, just so you know, we've modified the template a little bit for this year. We've actually reduced some of the information on the expense tabs to make it a bit easier for folks. The only thing that we've added, I believe, is training institution, if applicable, and estimated date of graduation. That used to be on the education tab, and now it's on the demographics tab. And you'll all be receiving a copy of this new template after today's webinar. Another thing to remember to do is double check all of the titles. That's one of the columns. It's, what is the title at the beginning of this month? Has that individual been promoted, and what is the title at the end? So just double check in case anybody has completed their training, that you're updating that. That helps us tell the county how many folks have successfully completed their program. And then on the invoice tabs, just remember that that's not a rolling list. The demographic tab is. All of those other lists, you should remove anything from the previous month. Those should only list expenses that you've incurred and are invoicing for this month. Next slide, please. Okay, so on those invoice tabs, are we gonna maybe have finance do this section, or would you like me to continue?
Be more than happy to jump in. Hello,
All
my
right.
name is Amy Molina, and I am the Director of Finance here at FLPPS. And so as a best practice, we make sure you always complete all the information on the invoice tabs for expenses that you have. And be sure to include all the documentation, supporting documentation. This does help move along your reimbursement payment back to you in a very much timelier manner. If we can't support the dollar with your number, the supporting documentation does not support what you're asking for reimbursement, we will have to come back to you and ask for it. So it's just best practice. Make sure that when you say you're asking for $10,000 in education, there is $10,000 worth of support that we can easily reference. I would suggest, if you do your supporting documentation, to put it in the order in a PDF file in order of exactly how the invoice template goes. So if it's education and then tuition and then car repairs, if you put it in that order, that makes it easier for us to be able to go right through it, check it off, and document that everything is there. And make sure you always put the training costs and tuition under education, and separate out any textbooks and scrubs under the supplies. There's also, there could be that you need to buy a laptop for a participant, and then that would go under actually equipment. So there is different areas, and if you have a question, please feel free to reach out to us and we will help you through this. Use the employment tab if you're expensing for program participants' wages. As Christina stated, they're in training. You can get reimbursed, and make sure you put it in at the gross amount for the employee, not their rent. And then, we can definitely, you could use that for if you have a retention bonus or a stipend that you give to them, put it under that too. And again, make sure you use the gross dollars. The career coach monitoring tab to expense your career readiness workshops and the success coaches. Success coaches should not be listed on the demo and training and programs tab and will not have a unique ID, but their expenses for paying either your in-house employee or if you're contracted should go on to the coaching career mentoring tab.
All right, I can take this section, the portal. Always upload your monthly submission to the metric for that month and year that it's due. So if you're looking ahead to February submission, that will be a look back on January, but you would put it in under, I believe it's usually the date due is February 7th or something, 2025. And for those that have been doing this for a while, you already know you have your logon information, but if there's anybody new, like I said, there's some new success coaches that have been brought onto the team, simply reach out to myself or to Linda, and we can request portal access for anyone that's new. You only need one person to do the submission. Very simple. There is an open text area if you wanted to leave a note for us. And then there is a section where you can upload your submission. Something to keep in mind, the portal is a little fiddly. It doesn't like anything more than 5 attachments. So if you have a large attachment, if it makes sense to have all of your supporting documentation as one PDF, that's an option. Another option is to utilize some zip file in order to upload your submission in its entirety. So when you submit, it will be, the metric will say not started. Once you submit, it goes through our review process, and there are 3 different levels of review. Like I mentioned earlier in the webinar, there's a finance review, a data review, and then the program management team will do a final review of your submission. Once it goes through, if it is approved, then it will say approved and pending payment. However, if we require additional information from you, we will place it into action required status, and then you'll be able to, that allows you to open up that metric and go ahead and make corrections. And please upload your amended submissions back onto the portal. Please note that we cannot accept submissions via email at this time. Next slide, please. All right, back to finance.
Sure. Hello, this is Amy again. And I'm gonna just introduce really quickly Whitney, Bub, the staff accountant.
Hello, I'm Whitney Bum.
Oh, you're muted.
Oh.
Or can't hear you.
Can you hear me now? No?
A little technical difficulties.
We can hear you, Whitney, but it's very soft.
Okay, can you hear me better now?
Much better.
Yes.
Much better.
Sorry about that.
Yeah.
My earbuds work sometimes and sometimes they don't. Okay, so some more best practices. Going forward, any submission received and approved by the 15th of the month will be paid that month. Anything after that will be paid the following month. We've got a new checklist worksheet that we created for you guys to help assist with making sure you have all the appropriate backup documentation for your submissions. Just please note that the checklist is really just a tool to help you guys. It doesn't need to be included in the submission, and it doesn't replace the expense and reporting template that you submit. Please provide backup documentation only for expenses in the current month's submission and remove any expenses from previous submissions. It just makes it a lot easier for us to see what's going on and what you guys have submitted when it's just for that month. Otherwise, things get really confusing and it just slows us down because then sometimes we have to reach back out to you. And then when submitting for reimbursement on employee wages, that should always be based on gross wages. We've seen quite a few people using employees' net pay, but we want to make sure you guys are getting all the dollars that you are owed. Next slide. Okay, so backup documentation, just wanted to go through this real quick so everybody understands what it is we need. Career coach mentoring, pretty straightforward. It's either going to be an invoice from the career readiness workshops, that's usually AVS Consulting, I believe, or payroll reports for the success coaches. Childcare, we want to see daycare receipts showing the child's name, the service dates, and then a receipt showing proof of payment. If we do not have those things, we will have to reach back out because we do need to make sure, you know, obviously it's for the right child and the service dates are covered under that submission. For education, we want to see the tuition bill. We want to see the school name, the student's name, what semester it's for, and it'll be the tuition bill, the tuition and fees minus any grants or scholarships would be the amount that we can reimburse. And then we also require proof of payment. For employment, we're asking for either a payroll report or the employee's individual pay stubs. Either one is fine, but we do want to see the participant's name and the pay period that the pay stub or the payroll report covers so that we can, again, make sure we're in the right time frame. For housing, mortgage bills that show the mortgage lender, the participant's name, and what month it's for. And then for rent, we do require a lease. We're not going to make you guys submit it every single time, but if the lease has not been submitted previously, we will need a copy of that and proof of payment. For the incentives, either a payroll report again or an individual pay stub that includes the bonus or stipend. If possible, if you guys can highlight the amounts or give some indication of where we should be looking on the payroll report or the pay stub. Sometimes it's not so clear. So any kind of direction on what we're looking at is very helpful to us. Supplies, we're going to want receipts showing proof of payment for any of the purchases being expensed. We obviously need to see what that expense is, whether it's actual school supplies or scrubs or something of that sort. And then the same thing for technology. We're going to want receipts that show what's being purchased and then proof of payment. And then for transportation, we want receipt and proof of payment for purchase of bus passes, vehicle payment showing the lender and the proof of payment with the participant's name. I'm not sure. I know Christina said we could cover Ubers and stuff. I'm not sure what would we need for that? Just a Uber receipt?
Yeah, I haven't seen any come through, but I know that there's been discussions about that, especially if, for example, if somebody's car broke down or something like that and they needed to get somewhere. Yeah, I haven't seen that, but I would think a proof of payment.
Proof of payment. Okay.
Yeah. So if they have their own account, they can print something out as backup documentation that'll show us, exactly what that trip is, to the school or to work even, right? It might be that they had to come to work and their car needs that repair. Be
Right.
sure to, let that participant know that not only is, their Ubers while they need to get back and forth to school and work, their car repair is also potentially covered. So we want to be sure that they, understand that this program is here for the next couple of years to support them fully, to help them get their next level of degree, and then it'll support you too. We want to make sure we support you in every way as their employer.
Sounds good. And next we just have a little checklist. We've got this in a PDF document that I believe Linda or Christina will send out later. This is just to help you guys try and remember and be able to go through and make sure you have all the documentation that we need. Because like Amy said, the less we have to go back to you guys to ask questions, the sooner you're gonna see these payments from us. So anything to streamline that, but we're also absolutely here to answer any questions, especially about any specific expenses or anything that might come up. And help you through that or try and figure out, our goal is to support these participants as much as possible. So we're here to help.
Okay, I feel a little guilty. I get the fun part. Really didn't plan it that way. For the new people, there's a lot of information here. So how do we take all of this and actually put it into action? We have a number of our partners who have agreed to share their experiences and how they've applied the funding, and we're grateful for that. With that, Kim, I'm going to have you go up first. Kim is from Rochester Regional Health Long-Term Care.
Hi, everyone. Thank you for having me do this, Linda. So we've had some really good success with flips. Actually, I think we're down to our final $4,000 here, which is both exciting but sad for us, of course. We would love some more funding. But we have really focused our efforts in the CNA space. So we were able to fully fund over 50 CNAs due to the funding stream we were provided. And then we have 4 LPNs as well. Those 4 LPNs will be finishing up school this summer. Largely, most of our dollars have been focused in the tuition and stipend space. That's just kind of a model that we've had built for several years and under some previous state funding. So we really stuck into that. Independent of flips in our offerings, we also have some support programs for our employees that we look to utilize through our life coaches. So we do have a life coach fund program, and we have a employee care fund program through the system. So some of those wraparound supports, we're fortunate that we can support our team members with in those ways, so we can really increase the amount of folks we can get trained. So that's largely where we've used our dollars. I know the stipends, for instance, have really been, just in turn, I think the stipends is what is helping those folks to pay the bills. We provide them ongoing while they're in school, right? So that's what's kind of helped folks pay their bills while in school. So instead of maybe having them reach out with that separate payment for something, by providing the stipend, they're getting the additional dollars while in school, because we've acknowledged now they can't work as many hours, or they're dropping down significantly, so they can focus on their studies. I think another success for the program at large, in the fall of 2023, of course, we adopted the state's updated policy at the time that we could go to a 75-hour program. Doing that and shortening the program has just really helped our efforts to increase the amount of folks we can get into the program, and the candidacy pool even. So we just saw a lot of success, a lot of growth, a lot of additional recruitment by offering that shortened program. We've really looked to MCC, I would say, since I came to long-term care now 7 years ago. We've always had a strong relationship with MCC, and though we're not actually engaged with them right now, in the past FLCC. And so we've worked with them very closely. We continue to be a strong clinical partner with Monroe Community College, and then, offer resources on both ends. So whether that be our own internal programs for the College of Health Careers, or MCC, or other educational providers, we've had a strong relationship there. So for CNA, we have our own program, but we look to utilize MCC and really help them to fill their classes whenever possible. So again, super appreciative of, the funding support this year. I do find, I think initially a few questions, but I think the reporting template and reimbursement template has been pretty straightforward. Seems very easy to use compared to some grants I've been involved with in the past. So.
Thank
Is
you
it
so
enough,
much,
Linda?
Jill.
Some of what we do. Good?
Great
good?
job.
Okay.
Yep, yep. I'm not surprised. Thank you.
Mhm.
We also have Christine Stallworth from the Jewish Home.
Hello, so I'm Christine Stallworth, the Nursing Retention Specialist at the Jewish Home. We have really focused the funds. We actually just sent 3 of our LPNs. They just graduated from RN school in December. One of them actually did use the bulk of the funding for childcare for her 3 children during that year, which was extremely, helpful and life-changing for her. Everyone else really is sort of that tuition supplies sort of piece. We have 2 CNAs that are currently going for their LPN, and we are also supporting them with a wage subsidy. And then we also graduated and used some of the funds for our 5 NATP students from this past November.
Wonderful. Thank you so much, Christine. And Peg from Erin Manor and Elemental. Are you here? Yes, I see you. Did you jump off?
Hi, Linda. It's Lori from Erin Manor. I don't think Peg made it on the call today, but
okay.
Yeah, I can just take a moment and, kind of debrief.
I'm here.
Oh, Peg, you're there. Great.
I am here. Sorry, I was trying to hit the unmute. I'm traveling. I'm here.
Okay, great. Thanks.
Thanks, Lori. Please feel free to jump in, okay?
Hi, everyone. Again, thank you, Linda. Appreciate it. Always, we're very appreciative of being a partner with FLPPS as well. Sounds like everybody's doing really great things with help from your program. So at Erin Manor, we are utilizing that in the hybrid CNA program. And we also have a success coach that we have brought on and utilized, who is doing a fabulous job starting in the classroom with the students. And she helps onboard them, recruit them into Erin, and she's done a great job at keeping the staff at Erin Manor. And we have students hitting, all new CNAs hitting their 90-day marks, 60 days, 30 days. So our retention of the students has picked up and remained strong, which we can't be obviously more appreciative of, because that's obviously everybody's goal, is to teach them and then retain them as well on staff. And we have done a great job with that, utilizing that success coach. And so our funding has gone to support of the CNA classes, and then a majority has gone to success coaching to bring these new hires on, and she works with them all the way through the 90-day process to keep them going, including orientation, orient them to the floor, helping them make friends, seeing what's going on. And she helps them navigate the newness of their career. So it has been very beneficial to us. So again, we are very appreciative of you guys.
Thank you, Peg. You're always on the road.
Yes, ma'am.
The last partner we'd asked to share, unfortunately had a family emergency come up, and she sent a statement that she asked us to read off. And it's not Laura Di Natale, but I'm going to read her words. Our director of nursing reached out to me asking how we could incentivize our CNAs to be preceptors and train our new CNAs in addition to their CNA role. In thinking how I could best help, I immediately thought of Anne Marie Shepard and recommended to the director of nursing that we have a great opportunity to partner with Anne Marie to provide career development training. So we reached out to Anne Marie Shepard to get her help in developing a curriculum that would help build the necessary skills to enable them to grow and further advance in our organization. It was a challenge in organizing almost 90 CNAs that work for a 24/7 operation to attend the training and ensure there was no disruption in the quality of care we provide our residents, but everyone rallied together to provide this great developmental opportunity for them. We received very positive feedback from the CNAs that participated. I would love to bring Anne Marie back in this year. I've started discussions with the director of nursing to understand what professional development training we can provide other nursing staff, such as our LPNs and RNs. We are very grateful for our FLPPS grant and the many partners affiliated with the grant in supporting our nursing staff. Okay, Christine, I'm going to throw it back to you.
Thank you so much. And just to add to that wonderful statement from Laura, just for anyone on the line that doesn't know who Anne Marie Shepard is, we have been contracting with her for some time on this work as well as other workforce development programs. She is the CEO and founder of AVS Consulting Services, which provides career readiness training. She has worked to develop a couple of different customized curriculums for a variety of audiences, including she's done some work for an HHA training program that we're also working on. So she's been fabulous. And if anyone's interested in additional information about her and the work that she does, please feel free to reach out to us.
Great. Yes, thank you for sharing that.
Definitely. All right. So do we have any questions in the chat, Linda, or didn't anybody wanna type this afternoon?
I don't see anything.
All right. Any questions from the group? I know we went over a lot, but I'm sure there's got to be some questions.
So, yeah, I guess I have a question. Just curious, when do you think we'll expect any updates for future CPT funding? I know we probably, some of the people on this call went through a webinar mid last year. So, and I know like things like CNA and HHA, we were told might be coming off the table at that time. I think they are. So when do you think we'd have an update on that, Christina, to understand what future funding streams might look like and how we can go towards, pursuing those?
So are you,
Mhm.
to clarify, are you talking about career pathways training through the 1115 waiver?
Yes, I'm
Or are
sorry,
you talking,
1115
oh, okay,
waiver.
because I
Yeah.
know we were also, we've also put in our budgets for year 3 and 4 for this Monroe County ARPA, and
Yes.
we're
So I guess I have
waiting.
questions about both. Yes.
Yeah, we hope
Any
to
financial updates, let us know.
Gotcha.
Yeah.
So, for this Monroe County ARPA work, we
Mhm.
have put in updated budgets for years 3 and year 4, and we are hopeful. Amy, keep me honest here. I want to say within the next 2 weeks, we expect to hear back from the county. Is that
We're
correct?
pushing that. They pushed it off, notifying us, they said by the end of February, but we're pushing them back.
All right,
We
all right.
wanna
They had
know
told us
more before
mid-February. So mid to late February. I know
Mhm.
we're pushing on them for it, but since obviously we're already in year 3, so having an approved budget would be extraordinarily helpful. So more to come on that. As far as CPT is concerned, we have launched that program. We've done a relatively small number of participants just because we were trying to get this the spring starts. So we have only contracted with a handful of training partners, but we know that moving toward the next semester, we will have a lot more training partners. I know that we are working to get a contract with Rochester Regional. Does anyone on the call from Flips know if they've signed the contract, or is it still with legal? Does anybody know?
It's still with legal.
Okay.
And is that through College of Health Careers then, Christina? Is that the
Yes.
focus? I know
Mhm,
since
mhm.
CNA and HHA have been eliminated or, are not. Okay, that would make
Yeah.
sense.
Yep.
Okay,
Yep.
all right.
Yeah. So Carrie, do you know when they're focused on, is it the next semester they're looking at, or do we not have information about when they're looking to?
I think it's working through a few questions.
Okay.
Were posed. So at this time, I don't think I mean, our goal is to get it done as quickly as possible. So, I mean, we know it's between the 2 legal teams, I guess. So, but we keep pushing to get those answers.
And then I guess for some of those partners, are there schools we could be recommending our students to that might have some of this funding, right? So if we're not the funded entity, right? If long-term care isn't it for like in this instance, right? We of course we'll end up finding out what's going on with College of Health Careers. But like if MCC or FLCC or those folks are players, you know, I guess I'd just be curious to those updates so that we can maybe direct people to where there might be funding sources, unless they're not in the educational sector, maybe they're in the other organizations.
So we are contracted with a number of educational institutions. We have not compiled a list yet. Carrie, do you know if, I believe it's our intention to potentially put that on the website and as we update the website, is that the case?
Yeah, we're working on pulling that list together and being able to put it up on our website so that potential participants could go and look and see who we're currently contracted with.
Great, thank you guys.
All right, so Peg has asked in the chat, what is the CPT funding? So that is another workforce development program. It is a statewide program. And it's the career pathways training. It's being funded through the 1115 waiver, and New York State Department of Health has elected 3 different workforce investment organizations across the state to manage that programming. And FLPPS has been chosen as a WEO for the Finger Lakes region as well as Western New York. And it's somewhat similar to this program, but where it differs is that the dollars are going directly to educational institutions to pay for participants' training. And another huge distinction is that individuals are being required to sign a participant agreement, and they will need to successfully complete their training, as well as a 3-year service commitment to work for an eligible New York State healthcare employer. And we can certainly give additional information to anyone on the call that's interested.
Kristen,
Carrie,
I think the only thing that I would share on that is that there's eligible titles that are defined. And we have to follow these. These were not defined by us, but under the nursing umbrella, there is, excuse me, LPNs, associate registered nurses, and registered nurses to BSNs and nurse practitioners. Under the professional track, it's physician assistants, licensed mental health counselors, masters of social work, credentialed alcoholism and substance abuse counselors, certified pharm technicians, and certified medical assistants and respiratory therapists. And the last category is frontline public health workers, which are community health workers and patient care managers. And the caveat is that individuals have to be, enrolled, meet the requirements for the program, be accepted into a contracted school, and they have to complete their curriculum by May of 2027. Some might push a little bit into June, but the funding runs out in March of 2027. So there's very strict timelines on that. And as Christina mentioned, they will then be required to provide a 3-year service commitment at a organization that meets a threshold of Medicaid and or uninsured patients for 3 years. The other caveat to the program is that if somebody drops out of the program, whether they choose that it's not the correct career path, if they're unsuccessful in the program, and if there is licensure that's required, if they don't obtain their license within 1 year of the program, they are required to pay back all of the funds. We could put a link into the chat that links you to our information page that has all of those disciplines, those career paths.
And Carrie, we're coming at it a little backwards, and we apologize for that. But how about you give a brief introduction to yourself, because I think it's important for this group to know who you are. Carrie is our new senior program director, and I'll let you take it from here.
Yep, my name is Carrie Hadcock. I'm a senior program director for obviously programs and initiatives. I have worked with some of you previously on programs under the TC3 program. We did do the complex care program, so I know that there are some of the nursing homes here who worked with us on that. And I did start out in the workforce space when this first started, but then transitioned on to other projects. So I have oversights of all of the programs here at FLPPS, and it's very nice to meet all of you.
Thanks, Carrie. And to those requesting more information on CBT, I'd be happy to send that out. And if there's anyone else, please feel free to reach out to me and I can get that to you.
Any other questions? All right, any other last words from anyone on the call? All right. Thank you so much, everyone, for joining us this afternoon. Hopefully this information was helpful for you all. And thank you, most importantly, for continuing this work. We're excited for another 2 years of this program. And Kim says, thank you all. This funding has been life-changing. It absolutely has been for many of their team members. It has been. And, you know, we've heard some fantastic stories, so keep them coming too. If you have success stories, please feel free to share them with us via email. We pass them along to the county in our reports as well, so that would be super helpful. All right. Thank you, everybody. Enjoy the rest of your day. Bye-bye.
Bye.